Now, we just celebrated our 19th anniversary of the center. So next year is 20. Hopefully I'll be invited back for that one. But we have some people who've been here for 15 years out of that 19 years. All right. So you get to also come up and get your award. The first one is not making eye contact, but Diana Cantola. No speeches.
Thank you, Pete. Love you.
All right, Gina Green.
Take it.
Nope. And then Fran Chigugoa. Fran, if you want. Congratulations.
Thank you.
So, going to give you some updates. And let me just start with two. You know, COVID's still out there, everybody. So if you want to wear a mask today, please feel at liberty to wear a mask. And I think we have some extras in the back, but it's, we're out of the center, so it's a little bit up to you, but absolutely feel free to wear a mask. And I'll put mine on when I'm done here. But let me give you a few updates on the center. Who has driven past the center, the new site in Placerville recently? Is it looking awesome or what? And Caleb's not aware of this, but at an all-staff meeting, somebody who's been here a while, Liana, about 4 or 5 years ago, we did a similar kind of breakout and talked about what we wanted to see for the future. And we had a whole envisioning and did many, many stickies about what we wanted to see in a new site. Now, I will tell you, not every single thing has come to fruition, but many, many things on that list we're going to be able to provide out of that new site in Placerville. And it is going to be awesome. And we're going to try to be setting up some tours so everybody gets a chance to do a walkthrough who was interested in doing so. But it is really exciting. And so there is something called certificate of occupancy. A certificate of occupancy is something that you get when you build a house, when you build a building that is kind of permits are overseen by the city or county. And it is a document that says, okay, your building is essentially done. You, as the owner, are able to do with this building how it was intended and constructed. We are anticipating getting that certificate of occupancy on October the 7th. October the 7th, which means for us that we will be able to start moving our stuff in, start moving your all supplies in, and getting ready for an opening date of seeing the first patients there on October the 12th. That's a pretty tight time frame, but we have been going through it and we're pretty sure that we're going to be able to pull this one off. So October the 7th is that first major marker.
Tree.
Oh, yeah.
Watch out for the tree.
Or should I say thank you, Kelly?
Hey, I married him.
Do you want to point out the walking trail?
We're having a little bit of technical
Yes,
difficulties, but the walking trail is up in the back. That's an awesome walking trail that we made sure that everybody had. Yeah.
So you're taking a look at the flyover at the outside of the building, which looks great. And we do have plenty of parking, unlike what we have in Placerville right now, right? Plenty of parking. We also have a walking trail that you will be able to walk during breaks or the noon hour, and with your colleagues. There will be some benches out there. You can go out there and read a book in the shade or whatever it is for the noon hour. We also have a charging station. We got a grant from the county. There is a charging station if you have an electric vehicle. We are obligated to provide that charging for free for the first 5 years to both staff as well as patients. So please put the word out. That would be an awesome thing too. And we're really excited, not just about the outside of the building, but the inside as well. And where we will, as you know, have medical, dental, behavioral health, math, or our STEPS program. We have optometry, which we're gearing up now, and we've started the interview process of interviewing optometrists, and hopefully we'll start that hiring process too soon. And we have a small pharmacy there that we can do blood collection and other collections. It's under a contract with Quest. And what did I miss, everybody? Did I miss anything? Pharmacy, thank you. Grant should have winked me on. And a pharmacy, and a 9th-grade pharmacy. It's awesome. So we are really excited to be launching that. It's going to be a great asset for our community, and it's going to be an awesome place for you guys to work. An awesome place. So for many of you to work. So hang in on that, and we'll be letting you know when we'll be able to come in and do some tours. And it's likely to be either towards the end of the day or the noon hour, and we'll be scheduling that with you. Because at this point, it is an active construction site. I was there yesterday. It's an active construction site. So you have to wear a hard hat as you walk through and things like that. So unfortunately, we can't just let you wander over there and take a look, but we will be scheduling some times for you to do that. HRSA, everybody knows that HRSA is our major entity that we work with at the federal level. And after going through COVID for 2 years, over 2.5 years, they have informed all of us, all of the community health centers that they work with, that they would like to hear, not just from us, from the leadership perspective, but they want to hear from all of our staff and get some input from you and find out what are the issues that you are addressing and dealing with on the front lines. So we have provided them with all of your work email, and they are going to be reaching out soon, and will be asking you questions via a survey. So stay tuned. I am not exactly positive when that's going to be coming out, but we'll give you a heads up when that happens. But it will be this month, I believe, sometime. So, and please do take the time to go ahead and fill that survey out and respond back to them, because what that means ultimately for all of us is it may mean specific direction for grant funds or programs or workforce focused activities and things like that. So please take the time to fill that out. Okay, does everybody know that Medi-Cal is going through a total revamp? It has been almost 10 years since they had the last Medi-Cal go-round and the Affordable Care Act took place. Does that shock most of you that it's been almost 10 years? It's been quite some time. So Medi-Cal is going through another rebid process, which they are undertaking right now, and actually just made an announcement that for El Dorado County, starting in January of 2024, the two plans that will be covering El Dorado County, starting in 2024, January, will be the health plan of San Joaquin, which we actually already knew about. They are going to be branding themselves to reflect more of El Dorado County and Alpine County, in addition to, they also serve right now Stanislaus and San Joaquin. And we've had many conversations with them, and they seem very collaborative and interested in serving our patient base. And Blue Cross, they no longer go by Anthem, but Blue Cross. Those will be the two, at this point in time, plans, health plan, Medi-Cal plans going forward for El Dorado County. We'll see what happens between now and January of 2024. But I did want to make that announcement to you. In the interim, however, the current health plans, Medi-Cal health plans, are working with us to launch something called CalAIM. And for lack of a better term, and Caleb may even be able to give you some perspective of how their health plan has been rolling out CalAIM, but it's really looking at whole person care and case management and getting reimbursed for case management, of which we've not been able to get before. So there are many elements of CalAIM that we're very excited about and trying to put in those applications to them now. But stay tuned, that word, that term, CalAIM, is here to stay, and look at it as, oh, wow, that may be something that is really good for our patient base. This may be a good thing for this patient that I'm seeing right now. And as we get that all launched and up and running, but we're excited about that prospect. Okay, I have some information, but not total defined information yet. But this is really a phenomenal thing that occurred in the last closure of the the legislature that just ended at the end of August. The legislature, in working with the governor's office, specifically identified community health centers at QHCs in California of an area that we have been really carrying the state in many ways on areas around COVID vaccination, testing, treatment, all the other things that we've been going through for the last 2 years, as well as just providing the everyday primary care actions that we've been doing. So in recognition of this, a bill was put forward by the legislature and the governor's office. It was a joint effort to recognize the efforts that have been done by all of you and us in the community health center world in California. And they are going to be awarding each one of you $1,000 as a recognition of all that you've done and as a retention for you to continue to do all that you've done as we continue to do the good work in our communities. Now, I have been on several calls with the state, and here's what I know and here's what I don't know at this point. It's $1,000. I heard that it was for all staff. Now, what I don't know is it for contracted staff or staff who only work just intermittently. There's some questions about that, and I do not have an answer yet on that. But our colleagues at the California Primary Care Association are working with the governor's office right now on defining those answers. And as soon as those are told to us, we will get that out to you. But everybody should really pat themselves on the back that not only are you doing fabulous work and have been, and I know we'll continue to do that, but it's being recognized at the state level. So all of you, that's fantastic work. All right, you have been seeing my emails, and you know I am not exactly floating off into the sunset, but I am planning to retire very soon, and I know our board has put in a lot of effort to do a very wide search out there to find the person who is going to be following me when I step out of this world and really take that big step forward into not only working out of our new building, providing some new services that we haven't yet provided, but also having a greater reach into our community. And one thing I forgot to mention too, we did get a grant from the county, and we have purchased, and it is on order, a mobile medical van. So our reach into the community, in addition to what we're already providing with the dental van, is going to be phenomenal. I am so excited about the future for everyone, and I'm really excited about the addition of Caleb Sanford, who will be taking my place and guiding you all into this new future. So Caleb, I think you've seen, and I've put some of his background, but I've known Caleb for a little while, and I have utmost confidence that he is the man to take over in my footsteps and to really lead things forward. So I am just thrilled that you're going to be joining us, Caleb. And we're doing some transition time for the next couple of weeks. He will be starting full-time on September the 26th. So you will see me a lot until the building is open and moved in. And at that point, I will be moving back from my position and doing some transition in the background with Caleb and doing some of the meet and greets with our county partners, our community partners that may not happen before the building opens. And maybe a few projects, special projects here or there, but that you're going to see me more playing with my grandsons, doing travel. Maybe Christine wants me to do pickleball and other fun things. And let me just say, it has been an absolute pleasure and an honor to have worked with all of you. I will have plenty of time with you before I leave, but not as a group. So I just want to convey that to you, but also that I'm really happy that Caleb is joining us to continue the growth and the phenomenal things that we have done in the almost last 9 years. So thank you all. So Caleb has quite a bit of experience in working in the community health center world. And I'm going to let you kind of keep that up a little bit, Caleb, but thrilled to have you.
Thanks, Sarah. Well, hi, everybody. It's great to be with you. I was looking at this picture of me up here, which is only like 2 years old. I was a little depressed to see the difference in my hairline. It's been a stressful couple of years, hasn't it, for all of us? But hey, you know, as Terry mentioned, I'm going to be your next chief executive officer. Your board of directors has asked me to do that, and that's just such an honor and a privilege for me to be able to accept that position here and to be able to serve you all and to serve with you as we continue to provide great care to this community. Before I go on, though, I want to take a minute to really recognize Terry for all the things that she's done for this organization and the transitions that she's gone through, from developing your medication-assisted treatment program to navigating the COVID pandemic, accelerating your transition to telehealth, you know, COVID testing, COVID vaccinations, all of that stuff, and now with this new mega state-of-the-art complex up in Placerville. She's really done so much for this organization. And so I want to take a minute for all of you to stand up and give her another round of applause. It's future dated for her retirement. So thanks again to her. And for the nearly 9 years of her life that she's dedicated to all of you and this community, and that's just really impressive. So thank you. So let me tell you a little bit about myself. I started my career in healthcare about 10 years ago, managing a handful of primary care clinics for a pretty big integrated healthcare network out in Iowa. And so like big healthcare systems here like Kaiser and Sutter and Dignity, because of how healthcare reimbursement works, we were limited in how many patients on Medicaid that we could take. And our prices were too high for people that didn't have any insurance. And so when somebody in one of those situations would call us to establish care, because they really wanted to come to our organization, we had to turn them away. We referred them to the local community health center. And that was really my first exposure to the community health movement. And I loved the idea of working for an organization that didn't have to say no to people, that could just say yes. That when somebody wanted to come and receive care, we could just say yes. Whoever you are, yes. And so I made my way back to California to work for Clinica Sierra Vista, which is one of the largest federally qualified health centers in California, but also in the country. Got a really great experience there. I managed about 16 clinics, from big urban clinics to little tiny rural clinics in the middle of nowhere. And then from there, moved up to Traversio Vasquez Health Center in the area, where I've been for the last 6 years. Now, my biggest accomplishment, though, is none of those things. My biggest accomplishment is convincing my wife, Kathy, to marry me about 10 years ago. That was hard. We now started to raise 3 kids. They're 9, 7, and 5. My daughter's my oldest, 9 years old, and 2 boys. They're a handful. And we've always wanted to be in this area. This is where we wanted to end up. My wife has family in this area, close to the mountains here, close to Lake Tahoe for my kids. And so about 4 years ago, I started researching health centers in this area, kind of planning ahead, how do we get to the Sacramento? And so as I was researching health centers, I came across El Dorado Community Health Center. And I knew at that moment, I said, this is where I want. And so I did a little bit of LinkedIn stalking online with Terry. Learned as much as I could about her. Tracked her down at a CPCA event, California Department of Care Association, in Sacramento. And I bought her lunch. She's rolling her eyes. I didn't really buy her. It was free. The event was provided, but I like picked it up off the table. And I said to her something to the effect. I said, Terry, look, everything I've learned about your organization so far, I love. This is where I want to be. So whenever you get around to retirement, I want to try to be ready to take over. Now, Terry looks pretty young. I thought she was like 40 when we had this conversation a few years ago. And so I was thinking, 2030, 2035, somewhere until you get to retirement age. So she sped things along a little bit faster than that. And so here we are. And so I'm excited to be in this position now. And I've gotten to know your leadership team pretty well. I've done some consulting for them for the last few years, strategic planning and some things like that. And I'm excited to start here full time to serve you and serve with you as we continue to do this great work that all of you are doing. Now, I've lived in California for most of my adult life. I'm not a native Californian, I grew up in Montana. But my mom's family is from Placerville. Her grandfather, William Rance, was a dentist here along with his brother, Lester. And one of your board members, Jim Zeke, actually remembers being a patient of Dr. Rance when he was a kid, a long time ago. And so that's neat. So I'm excited to be able to continue that kind of family legacy of providing access to great healthcare services here in this community. So I didn't actually start here for a few weeks. I came today to get the free snacks that they had. So let's give a
Who was Madeline?
Oh, Natalie.
Madeline.
Well, can we give a round of applause for everybody who helped put this together? This is a lot of work. And so as I start here in a few weeks, some of you may be wondering, some of you may be worried, what's the new guy going to do? Is he going to change our lives? Is he going to disrupt things in all our community health centers? Well, let me talk about what my main goals are as I come in and try to serve you and serve with you. Number one, I want to make sure that the communities that we serve continue to have access to great healthcare. Okay. If we've learned anything during the pandemic, it's that healthcare changes. And that the needs of the community change and the ways that they want to access healthcare services change. And so as an organization, we kind of got caught with, we got caught off guard by this pandemic and had to move very quickly. But all of us did really well, especially in the community health center world. We acted fast at that. But we learned from that we need to be able to react and respond and anticipate these changes even better. And so that's something that I hope to be able to help all of you do, is that as healthcare continues to change, and it will, if you thought the pandemic was jarring, just get ready, because more things are going to come, more changes are going to come. We need to be ready for that. Number two, I want to make sure that we continue to make decisions that will enable this organization to be sustainable long into the future. So those of you who have been here 15 years, and can I say that's impressive, to work at the same organization, and I'm guessing you love it here for 15 years, that's really impressive. I want you and everybody else here to be able to work here as long as you want, for decades if that's what you want to do. So we need to make sure we're making decisions that enable that sustainability of the organization. And number three, I want to make sure that all of you love your jobs. Is that okay? Should we stop there? No, but this community health work that all of you are engaged in, this calling that all of you have to provide care to all those in need, the mission that you and this organization are on, to take care of everyone, no matter what their financial situation is, their race, their ethnicity, their gender, their sexuality. This is a great work that you and everybody else in the community health center world are doing. And I want you all to be able to love that. I want you to be able to love it because it's really exciting work. Now, some of you already love your jobs, and that's awesome, and I want to learn what we're doing really well as an organization right now so that we can continue that, so that we can make sure as we go through this transition that we don't lose any of those things that we're doing. But for those of you who may be struggling to emerge from this pandemic with the same passion that you may have used to have for your work, I want to figure out with you, what can we do as an organization to get that back so that we can bring the joy back into healthcare. And throughout the industry, we've lost some of that joy. We need to bring that back. I want you all to be proud of where you work. And I want on Sunday nights when you guys are going to bed and getting ready for the week, I want you to be excited by the idea of waking up Monday morning and coming back to work to serve these communities. And it's hard sometimes. In the last couple of years, it really beat a lot of us down, but we can get back there. And so that's something that I want to devote my energy to help all of you to make sure that you really look forward to Monday. Thanks for welcoming me to this organization. It seemed, I've shaken hands with a lot of you. I apologize, I'm probably not going to remember your names the first time. I'll do my best. But thank you for welcoming me here. I look forward to working with you. And just thanks for being here. Thanks for being here and choosing to serve in this movement. You all could do other things with your lives. You could get jobs that might pay you more somewhere else. There's other things that you could be doing, but you're here, you're choosing to serve these communities, and that's impressive. And so can we give a round of applause to all of you? Well, thank you again. I'm going to turn the time back over to Terry. Thanks again, Terry.
Hi, good morning. I'm going to speak a little bit about community health center movement and the history of it. Not so much the history of EDCHC, but just the history of how community health centers came into being and why we are here. You might not be aware, but the community health centers began as a social justice movement, and it began with the civil rights. They asked me to speak today because of my age, and I remember. So 1965 is the health center that started with Lyndon Johnson's War on Poverty. It began with the knowledge of people that worked within communities that were impoverished, the communities that were not being served, that everyone deserves to receive health care within the communities where they live, within the means of what they can afford, and it is a right to get health care. That access should not be denied to people, that it's worth fighting for, that it's worth marching for. And it's worth working towards the understanding that everybody deserves to be given health care within their own language, to be served by people who care, and to be served in a manner that is respectful. So from the civil rights movement began in 1965, 2 health centers started. The one in rural Mississippi and one within, I think, the Massachusetts area in an urban setting, inner city. And it was those 2 seeds that started the entire movement. This thing that you are a part of is a movement and is supported by both sides of the aisle. There have been Republican presidencies, Democratic presidents that always have supported community health centers because it is such a magnitude of what you do and what it provides to people that is of the utmost importance. In El Dorado County, before the community health center was here, there was very limited access to anything that had Medi-Cal. And so there were many times when people just only received services at the emergency room. And so when this place started in 2003, my memory serves me correctly, we began 2.5 providers, 2 FNPs, Bona, Diane Bass, and then Dr. Arona, and a very small staff. We had a wait list of, I remember, pages. Yeah, it was unbelievable the amount of people that were trying to seek care. I started in reception back in 2005, and I remember just the constant stream of people that would come in just trying to get access for their children, for themselves, for their patients, for their parents. There was nowhere else to go. It was an incredible journey and has been the work that we have done to grow ourselves, the establishment of the health centers in Cameron Park, serving people from Diamond to Placerville, down the hill, and now also being able to consolidate and serve more people in Placerville at the big building. Those things are extraordinary. And the reason why they're extraordinary is that when people come to us and when they're served, you are providing kind of social justice. It's not a woke movement. It's an importance. It has been here since people started back 57 years ago, trying to bring primary care to people who need it, who deserve it, and who don't need to be turned away. So as Kayla was mentioning, those health systems that are here serve people with the entitlement of health insurance. And that is an entitled thing. Not everybody has it, as we know. And so for us, when people walk through our door, we don't ever turn them away. And that is an amazing thing. It's something that I take great pride and privilege to watch all of you, all these years, serve people that are challenged, serve people that sometimes don't give back the same care that you are giving to them. But you come back every day and you work in this movement. There's not one person here that hasn't touched a patient in some way or another, and you have made such a difference in their life. And you've done that through this movement. It is a joy all these years to watch you work. It's a joy for my friends that are the advocates, to the beautiful people that are the reception, to all the providers, the billers, all the beautiful amazing in the back office, everybody in finance, those on the leadership team. Every day, when you come to work, you work in this movement. You do more than just sit in healthcare. Every day you move forward, that's social justice. So such importance. And I hope you remember that. It's hard to come to work sometimes, as Caitlin said, and we are all exhausted. But we are exhausted for all the right reasons, because those things are in need, and this movement addresses it. So from that history, starting back in 1965 to today, is what you do, and it's what we are. The core value of anyone at a community health center is what is best for our patients and how to serve them. And every day you prove that by being here. Thank you.
It all began 50 years ago as a modest social experiment during America's war on poverty. The goal? To bring doctors and primary and preventative health services into poor urban and rural communities, places where health needs were neglected and ignored by mainstream medicine. A revolutionary partnership was created, bringing together for the first time reform-minded physicians, nurses, local community leaders, and the federal government to build a new type of community-based health care. It would serve all people, no matter who they were, where they lived, regardless of income or insurance status. And it would empower and give voice to people living and working in those communities to direct how health care was to be delivered. That small investment 5 decades ago has saved countless lives and strengthened thousands of communities. Today, community health centers stand as the largest and most successful primary care system in America. Through their shared mission, they provide high-quality, cost-effective services, including medical, dental, behavioral, pharmacy, and vision care. Community health centers are a vital health safety net for more than 23 million Americans, including 7 million children and over 260,000 veterans. In over 9,200 communities, they are opening the doors of healthcare, giving more people the chance for healthier and stronger lives. Community health centers go beyond the traditional 4 walls of medicine to break down barriers that often keep people from getting the care they need, such as lack of transportation, language and cultural differences, income, and insurance status. Health centers also work in partnership with others in the public and private sectors, developing local strategies to address the root causes of poor health, such as nutrition and food insecurity, homelessness, environmental conditions, and unemployment. Community health centers are a leading model in primary care practice, helping to transform healthcare delivery in America to enhance quality and reduce costs. Years of research shows health centers are more accessible than other providers to patients who are new, uninsured, or have Medicaid. Health center patient outcomes are as good as or better than those of other primary care providers, even though health center patients are challenged with more complex health needs. Health center care reduces mortality, health disparities, and risk of low birth weight. Community health centers have broad support in the public and private sectors because they produce value, not only for their patients and local communities, but also for governments at all levels and the American taxpayer. When compared to other healthcare providers, health centers produce over $1,200 in savings per patient per year, and health centers generate $24 billion a year in savings across the entire healthcare system. Their patients are less likely to visit emergency departments for non-emergency care, and hospital stays are lessened or even prevented because health centers focus on prevention, patient education, and effective management of chronic and costly diseases. But health centers are more than just healthcare providers. They serve as economic engines in some of the nation's most resource-disadvantaged rural and urban communities, stimulating job and small business growth and purchasing goods and services. Collectively, health centers generate an estimated $26.5 billion in economic activity in local communities. Nationwide, health centers employ over 160,000 full-time doctors, nurses, and other healthcare professionals and support staff. And that includes our nation's veterans. They are often one of the largest providers of jobs and job training in their communities. As America's need for primary care doctors, nurses, and other healthcare workers continues to grow, teaching health centers play an important role in ensuring an adequate workforce for the future. And as frontline providers, health centers aid in protecting their communities and overall public health in times of widespread healthcare emergencies and natural disasters. Since their early beginnings, community health centers have been called on to do more and more, serving greater needs, and they have always answered that call, making people healthier, strengthening communities, and producing value. Yet today, 62 million Americans still live in areas with little or no access to doctors or health services. So the question is, will community health centers be needed in the future? The answer is yes. Imagine an America without them. America's Health Centers. Value in healthcare today and tomorrow.
Buenos dias.
Buenos dias.
Good morning, everyone. I'm very happy to be here. I'm not too far behind. The old timers have been here 14 years. We're going to be breaking out into some sessions to talk about, how we see ourselves with aligning with our mission. My hypothesis is that for many of us who work at the community health center, our alignment to the mission is personal. And, I, for one, over the years, I've seen my own hopes and dreams in the children that we serve. I don't remember having a family doctor growing up. I was a typical low-income Mexican-American kid. I grew up in a trailer park the first 10 years of my life. At the age of 12, I started spending my summers working in the garlic and green onion fields of the Salinas Valley. And that was all good. It shaped my trajectory to where I am today. I think what wasn't so good was that my parents lost their 7-year-old son, my brother Jaime, to a very curable childhood cancer. And I think I wonder, over the years, I've wondered if my parents spoke better English, if they had a higher income, if they had a higher level of education, if they had better literacy, if they looked more American, whatever that means, would things have been different? I don't have answers to those questions, but I do find solace in God's incredible gift for me to serve communities like my family. I'm proud to work in a place that welcomes people, that welcomes all human beings with all their different rhythms and flavors and colors. That we accept the challenge to work a little harder, to go the extra mile, to provide quality care to those that are poor, to those with lower levels of education, to those who may speak a different language, who might have a different way of gender identification, sexual orientation, and all our patients with the different disabilities that they come with. We, these past few years have been challenging. We've experienced fear for ourselves and for our families, for all the parents out there. We've had to juggle work, childcare, being teachers, dealing with schools. We've gone through a fire. We've watched our workmates struggle with being displaced, with losing their homes, and our patients as well, being displaced and being in shelters. We've been through so much, and then we still have a lot of transitions ahead, a lot of changes, but I think one thing remains constant, is that we continue to be whole, we are not broken, and we are resilient. So that gives me a lot of optimism that we have a great future ahead, not only for ourselves and for the work that we do, but for our patients and serving our community. But it's not going to be easy. So my saying, maybe you can all say it with me, is La lucha sigue.
La lucha sigue.
It means the struggle continues. And if you know anything about my life, is that I thrive in hard work and struggle. That is what keeps me going. That is what gives me fire, what keeps me alive. So I hope you all can find that in yourselves today.
Okay, now for the breakout. Thank you, Dr. Velasquez. Awesome presentation and setup for where we are right at this moment. Okay, we want to engage with you, and we're going to take just a little break as we go into some breakout groups. And one thing, and thank you, Kevin, for joining us in the back, is if you parked down that way, if we can get those who may have been in an area like right by the buildings, to bring your car up here. And Kevin, I don't.
I think we're good at the moment.
We're good at the moment?
I think we're good at the moment, unless we bring another 100 people.
I think we're set. Thank you. And Kevin is a board member of ours as well, so thank you, Kevin. Okay, so we now want to hear from you, and we're gonna take a little break and let you get something else to drink, the restroom, but we're gonna break out into about 10 groups, and I have leadership. Can you raise your hand? As well as Megan, Andrea Quintana, yep. Who else did you ask? Becky, they're all acting as facilitators this morning. So we're gonna ask that you break out and try not to do it with the people that you normally work with, so we can get some other feedback from you. So if I see a group, if we see a group and it's like, you guys sit together every day, we're gonna kind of shut you off. But these are the 3 questions we're gonna ask
Do you need
you,
me to take a
and we want to get your input on. We're gonna have in that group, there will be a scribe and a reporter. So, and we're gonna come back and debrief. What is your personal alignment with our mission? Dr. Velasquez really gave that personal alignment. And I know many of the rest of you have that story too. It's really impactful to hear that. So what is your personal alignment with our mission? Why do you choose to work here? Those two should probably go hand in hand. What about the job gives you satisfaction? And that's going to be important for us to capture because Caleb's going to want to make sure that we're pushing those things forward. So you have about 5-10 minutes. Take a little break. There are obviously the tables here for you to sit in. If you want to go outside, there are 3 picnic tables out that way and 3 right in front. Awesome feedback, everybody. I'm going to do a little bit of a time check. I want to make sure that we also get some feedback and input into the last 3 questions. So what I'm going to have you do is just talk amongst your table there. But here's the thing. Okay, there's not a one of us here in this room that isn't going to go through some change in transition in the next few months. We've had tremendous transition, every single one of us, in the last 2.5 years with the pandemic, being in healthcare. That's been a huge change. We have some changes ahead of us too. They're a little bit different. We're opening a new building. We're adding new services. We're providing expansion into our community, which is all awesome. You are getting a new CEO. Every single one of you will be impacted by that in one way or another. There are many changes on the horizon. Change can be very good, but change can also be a little angst producing. So if we can kind of talk amongst ourselves a little bit, and if you can write down some key comments about what you see the changes that are coming, what excites you about those upcoming changes? What are you concerned about? Okay, good thing for us to hear about now. What suggestions and questions do you have for us about these changes that are on the very near horizon?
And she's a little worried about confidentiality and juggling, like if the patients are gonna, question why she's running late or trying to talk to her when she's working at her desk. A lot of people are concerned about how the pod works, how hard it's going to be, or how confusing or loud. My question was, is there going to be room for me? I feel like sometimes there's, we have providers and we have therapists and we have nurses and we have this, and it seems like sometimes we run out of spots to meet with somebody and we need confidentiality. So is there enough room for steps in behavioral health? That was another one of my questions, just because I'm used to not have, always having a room available. And then somebody was concerned about how the locks are going to work. Are they always going to be open? Are we just going to have people in there at all times? And then the questions we have about the transition, people are worried about how we're gonna transition so quickly from getting it signed and opened and then transitioning with only a few days. Some people wondering how realistic that timing is. And will everything work, like computers, Wi-Fi? And how will the kiosk work?
Good question. Okay, who else? Sure.
Come up this way so people can see you. Sorry.
Okay, what are we excited about? What kind of more bathrooms in classrooms? We're also excited about case management, like outreach of opportunities to support more of our community. We're excited to have the power to teach more people about nutrition and just being able to provide more chronic disease management. Really excited about the new updated equipment and technology like sync time and other things that are being brought to the building. We're excited about the growth mindset of leadership and how we're just keep looking towards the future. Excited about unifying Diamond Springs and Placerville, being more of that less siloed. That seems to be an issue a lot of us have. We don't all work together all the time, so bringing it more together. And then just having so many services under one roof, the convenience for patients, and really focusing on that patient-centered medical home model. What are we concerned about? We're concerned about getting lost in the new building. We have Jerry, who just started recently. She's still finding her way through Placerville, and now she's going to have to learn a whole new set. We're concerned about leaving Cameron Park in the dust. With the focus on the new building, is there going to be attention to what's going on in Cameron Park and be able to sustain services there? We're concerned about disruption to operations, just like Susan said about moving so quickly and how it's going to affect staff and morale and just feeling like lost and not settled well. Okay. Questions you have about the transition? Will funding opportunities be available to sustain operations post-COVID? So we know that there's a lot of grants and monies available because of the COVID pandemic, but once we're finally in a place where we've moved forward a little bit, are we still going to have these grants and things available to us to keep going? How will leadership dynamics change? So a whole new set of people, like is there going to be effects, it comes top down, so is there going to be effects for things going on in leadership? How is it going to slow it down to all of us on the floor? And then what policy changes are going to be put in place is another question. Well, thank you.
So, my group thinks we're really excited about expanding services, expansion of services, directly mentioned, needing more staff in the new building, shorter commute, patient group setting, for education, expansion of services was a big one. Concerns, just privacy in the workplace, noise level, masking all day due to proximity space. Callahan was mentioned, I think, well. Server integration, short time, storage space. I guess the second and third questions got one together, but just in terms of the transition, just concerns about timeline, what is it going to look like? Certain departments be ready, prepared, they're going to, just adjusting to their workplace, new workspace in a timely manner. Those were concerns about transition.
This table is talking about the new building and the changes that are coming, the growth that entails, the opportunity now for departments that have been not within clinic structure to actually be again within a clinic structure.
for the classroom, Diamond, those new services that are coming, labs, optometry, et cetera. Any new equipment or new furniture that we might be getting, so that's excitement there. The concerns though are being able to continue living up to the community expectations. The concern of perhaps not having enough room for everybody, physical space within that new building or adequate staff. They're worried about the move itself, the physical move. How will that move forward? How will we move from our current offices to the new building? What is that timeline? What does that look like? They were also concerned about if our operational systems will mirror the same in Cameron Park as in classroom. Will we continue to be able to walk into either or any site into our buildings without there being a huge difference between the two? And then questions about the transition. What are the 3 things that our new CEO will be doing differently? We'd love to know. Inquiring minds. And then the other, will we still have the opportunity to keep our remote work days? Thank you.
What we're excited about is the growth, the new staff, the expansion of treatment, especially for dental, meeting new people and patients. I'm really excited about a full-size fridge because we don't have one in dental, half a fridge. And then also a shorter commute for some of us, really nice. And then what are we concerned about? Some of us are traffic, just because on the very flat, a lot of traffic. And then the drastic fast change. And what are some questions? What questions do you have about the transition? Also, is everything going to work, like CW, all of that online stuff, and then moving to quickly the transition there. And that's it. Are you gonna go? I'm looking surprised. Oh, that's on you.
Rooming system, the safe rooming system, and just being able to see more friendly faces throughout the day, consolidating. And then concerns, just the unknowns, just people not sure really what to be concerned about. And then price of gas and changes in commute times, and retaining and recruiting providers for the new building, the different sites.
Some of the things that we're excited for are obviously all the new equipment that comes with the new office desk, computers, the new additions like labs are going to be available. We're excited about having our new CEO. We also are excited about seeing the company grow, continue to move forward. And then that's that we're going to eventually be adding.
All right, Caleb, good work on it.
Despite all the costs and the excitement of the new building opening, the possible delay of the new building being open in time, transitioning patient care and still offering quality services without being hiccups, future power outages, generators and batteries, how are we going to handle this, privacy within the building of television, and personal space for belongings and jacket for respect. Questions that we have about the transition is when will our tours begin? And are we going to have our Christmas party there this year?
Oh.
Okay, one more.
One more.
Sorry.
All right. What are you excited about? A lot of people know me. I'm very techy. The double monitor for sure. The lab's gonna be on site, so remember that. I didn't get my labs done. Road, the mobile van or bus, whatever site it's gonna be. More engagement in the pods, just everybody just being easily accessible. Hi, girls. Hi. More bathrooms for sure in Placerville, for sure. What are you concerned about? Technology working properly, power outages and generators. Those are one big one. Too many changes at once. The move-in timeline, security, just because the parking lot's so big. It's again, security. Equality among the facilities, just because we're having a big new building doesn't mean we forget about Cannon Park, right? Seating arrangements, again, even though we have accessible, but it's still an issue about the noise and stuff, it's still concerned. And then other things we're concerned about, staff retention. What questions do you have about the transition? Who's moving our stuff? And then what will patient care look like the week of moving in, or the day of? What does that day look like for us in the future?
Okay, we'll get everybody.
Pretty much what has already been talked about. What are you excited about? Everything that's going to be coming, new services availability, the ability to change and grow personally, professionally. What are you concerned about? We want to maintain our values as we get bigger. We want to maintain our culture of work-life balance. I think retention of staffing has been mentioned, as well as the pod system and confidentiality. What questions do you have about the transition? Maintenance of transparency, as Terry's been doing, and leadership collaboration with others.
Some of those things, other things, you brought out some good perspectives, and we'll be getting back in touch with you too. Let me just say thank you to Madeline, Diana, our facilitators and scribes, and all of you who make up the Community Health Center. You guys are an awesome group of people, and I am really happy to work with you. And I'm really excited about passing it over to Caleb. And I know Caleb will have some great ideas, and we'll be working with you on implementing those into the future. Have a great day, everyone.